In today's interview, I go deep with my personal dentist, Dr. John Bocchi. John is a airway specialist who focuses not just on helping you have a beautiful, bright smile, but he also focuses on the fact that your mouth and the shape of your mouth affects the way you breathe. He's based out of Reno, Nevada. And in this episode, we go deep into how to preserve healthy gum health, how to preserve the health of your gum pockets, which is literally the size of the palm of your hand. And we talk about the connection between dementia and oral health. We even go through his personal oral care routine. And I share some of the insights that I walked away with when Deepa and I went to Reno to see him at Sierra Smiles and Airway Dentistry in Reno, Nevada. It was like a very unique and amazing experience. And since then, my oral health has gone to a whole new level. And I want all of you to have great oral health because it's so vital and important to your long-term wellness. It ties back to your metabolic health. It ties back to your brain health. It ties back to your immune health, to your digestive health, to your cardiovascular health, to your self-esteem and your confidence. All of these things are connected to how we breathe and the quality of our oral health. So watch this episode, take some notes, enjoy John. His beautiful energy, I know, is contagious, and his wisdom is very powerful. So enjoy this interview with my dear friend, Dr. John Bocchi. John, how are you doing today, my friend?
I'm doing great, Sachin. How are you doing?
I'm awesome. Every time I spend time with you, it lights me up. It inspires me, literally and figuratively, to be a better human. And thanks to you, I'm breathing better. My oral care is the best it's ever been. And I want to thank you and acknowledge you for the amazing work that you do. And thank you for being here to share this with our community as well.
Thank you, Sachin. I'm so happy to be here. You've had a big impact on my life and career and my family's. And, we're all healthier, better people because of you. And what's great about what you do and what I do and, you know, other people in our community is we strive to make each other better. We can't do this all on our own. So the more and more people we can get like us out there educating people, the healthier we're going to make our world.
Awesome. Thank you. And one thing I know, I think you might know this, but our listeners may not, is I was this close to applying to dental school. I was getting the catalogs, I was getting all the, application process and everything set up. And I live now vicariously through dentists like you. And I'm so grateful. Like, working with so many dentists now is really a full circle moment for me because I get to see and really like experience myself how powerful good oral health is. And we met through a dear friend of ours, mutual friend of ours, Gary Cady, who kind of spearheaded and pioneered a way of looking at dentistry as whole health dentistry. And I know you're part of that movement. And I was so grateful to be able to come, my wife and I, to come to your office to experience the magic that you guys do at Sierra Smiles. And, not only do you have a dental practice, but you also have an airway practice. And I want to spend some time today unpacking that because I think just like chiropractors, a dentist, maybe to the layperson, all get lumped into the same category. And if you've seen one dentist, you've seen them all. But that's not the case. Just like chiropractors, we have different techniques and different ways of approaching a client's spine. You have unique and in various ways of approaching people's oral health. And if people aren't aware of this, a lot of our metabolic function can be traced back, or at least dysfunction and good function can be traced back to the state of our oral health. So I'm curious, John, one thing that inspired me to look into dentistry is I was good at my hands and working with my hands, and I love tools, and I loved, being able to help people, feel like $1,000,000. My first business was a barber shop. So within half an hour, people would come in, almost looking desperate and depressed, and they would leave feeling like $1,000,000. And I know you help people do that with the work that you do, but I'm curious, what inspired you, A, to go into dentistry, and B, really focus on airway dentistry after that?
That's really interesting, Sachin. One of the things that I looked at when I was looking into dentistry was I liked working with my hands, kind of like you mentioned there. And, I've always been very entrepreneurial in spirit. and I wanted to be able to own my own business.
Mm.
So looking at those two things with dentistry, it really got me involved in building a relationship with patients and getting them healthier, was one of the major factors into looking into it. As I started going through school, it was back in the mid 2000s, early 2000s, and that's kind of when the cosmetic revolution kind of started. And I got really interested in the cosmetic sides of dentistry and, the impact you can make on somebody of how they feel about themselves. And so I came out of school, and that was my goal. I wanted a small boutique practice where I could do cosmetic work. And I finished school in 2005, 20 years ago now. It's hard to believe. And a couple years later, we had our big recession, the crash in the economy. And what I found is those dentists who really built their practice on just cosmetics, a lot of them went out of business. And that was one of the first times you ever saw
Mm.
a dentist go out of business because all those cases dried up. There wasn't disposable income to be able to spend on that. So, from looking at it from a business perspective, I was able to, see that it was important to have a strong foundation of families and people who are seeking general dentistry. And, from there, I began to grow my business just based on getting patients in the door. And, I'd always been interested in the oral systemic link, and you were starting to hear about that a little bit in the early 2000s. And now it's grown into, complete health dentistry and the impact a healthy mouth or a unhealthy mouth can have on the body. And, long term, all these chronic diseases that we're all battling, a lot of it does start in the mouth.
Let's talk about that because people may not be aware of, systemic health and dentistry.
Mhm.
So what are some of the places we can trace or diseases we can trace back to or dysfunctions we can trace back to poor dental health?
Yeah, so the main thing when we started researching it and looking at the research, it was bleeding gums. And bleeding gums are a major factor in chronic inflammation. If you look at somebody who has periodontal disease, which is inflammation of the gums and bone loss around their teeth, the little pockets, everyone goes to the dentist. Hopefully, your dentist is measuring the pockets around your teeth, where the dentist or hygienist will measure out the one, two, threes, fours, fives, hopefully not deeper than that. But if you look at the surface area of the inner lining of those pockets, it's about the size of your palm. And many people, they come to the dentist and they say, "Oh, my gums have always bled."
Hmm.
It doesn't hurt, but they bleed. And that bleeding allows for bacteria entering your bloodstream all the time, not just when you brush, not when you floss. Every time you chew, if a chip hits your gums are bleeding, the bacteria is getting into the bloodstream. So it is a source of chronic inflammation. Back in the mid 2000s, Time magazine came out with a article about chronic inflammation and the impact it can have on the body. And that I felt like that really kind of started to set it off in kind of the general public about the importance of gum disease. So, gum disease is a major factor. They've found over 700 different types of bacteria in people's mouths. Not all of them are bad, but there are quite a few that are bad for gum disease or root canal therapies that aren't fully healed, decay, and even some that are very healthy for you. So we will even do bacterial testing to determine what type of bacteria are in your mouth, so that we can try work on changing the oral environment for people.
When I go to the dentist and they put the little pick into my gum line, it can be a little nerve wracking because it just is part of that experience. And I think I brush my teeth too hard. And you
Mhm.
had a chance to look in my mouth when I came to your office, which we'll talk about in a second. So I'm curious, sometimes like we try so hard to have good dental health. What are some common mistakes that people make? Maybe I like to call it when keeping it real goes wrong. Maybe can you brush your teeth too much? Can you brush them too hard? Can you do the right things wrong? Tell me some of the common mistakes you see people making when they're trying to take good care of their oral health.
Yeah, you can definitely overdo it. And one of the I would say it's not necessarily a fad, but obviously everybody want wider teeth. They want that nice, big, bright smile. And a lot of people use whitening toothpaste because of that. A whitening toothpaste typically are very abrasive.
Mm.
So they don't necessarily whiten your teeth, but they remove the stain on your teeth. So people who want whiter teeth using whitening toothpaste, I think it's a really good idea to brush really hard. And especially if you have gum recession, that abrasive toothpaste in the toothbrush can significantly wear away your tooth structure. So that's a major thing. You can certainly overdo it. One mistake a lot of people make is they end up brushing their teeth immediately after a meal. And
Mm.
what happens is when you have a meal, especially if you're drinking an acidic beverage, um, your oral environment is in the breakdown mode, so it is very acidic. So if you go and brush your teeth while the teeth are in their breakdown mode and not being rebuilt, it can cause wear, again, just from brushing, much more rapidly than if you were to wait a couple hours or swish with some water or use something with a higher pH to try to kind of change that oral environment. So you can certainly overdo it.
Yeah, that's what we've been told, right? To brush your
Mhm.
teeth right after you eat something to get any of the food particles and things like that out of your teeth. So it's better to rinse, it sounds like. Now, my son, who you've also met, Devin, he's currently in Invisalign.
Mhm.
And so the encouragement is to like eat something and then you have to brush your teeth and then put the Invisalign on. What would you say in a situation like that? Is it better for him to do like a just like gargle or rinse with water and spit that out versus brushing his teeth?
In his situation, he's got good oral care. He's not really high risk for decay cavities. Certainly it would be important to swish with some water. You don't always have access to a toothbrush. You don't want to carry one around everywhere. So swishing with some water, and then if he felt like there was still stuff in his teeth, maybe have like a toothpick or floss that he could use to kind of get out. But I wouldn't worry about brushing every time. And then if he started, the nice thing about Invisalign or any kind of the clear aligners out there is it's a carrier tray. They fit on your teeth very tightly. So for people who are high risk for cavities, you can actually put some gels inside the trays, which can actually strengthen the teeth.
Hmm. Okay, good to know. I know you and I are both big into toxicity and just looking at the whole picture when it comes to health. Uh, what are your take on Invisaligns? Things that appliances that people put into their mouth. Any risk for toxicity or concerns? There's a huge awareness that's taking place around microplastics and things like that. I'd love your thoughts on that. If that's something that we should or should not be concerned about.
I think we want to be careful with anything we put in our mouth. The Invisalign, they do what's interesting is there is like some gluten in some Invisalign trays. You can actually ask for a gluten-free Invisalign tray. Many people don't know about that.
Oh, I didn't know
Um,
that.
but certainly the microplastics, and that's something that has not been researched in dentistry. Dentistry forever, we've had appliances that are acrylic or plastic that we put in our mouths, and that's still kind of up in the air of what kind of impact that could have on a person's health.
Yeah, and I guess if somebody is concerned about that, beta glucans, supplementation with beta glucans can, whatever, if that is even a concern that somebody has, they can take it supplementally to bind up microplastics and pull them out. Beta glucans are found in mushrooms. So eating mushrooms regularly, oats have beta glucans, and then you can also take it supplementally. Uh, that could be a way to potentially support that pathway if somebody is concerned, I guess.
Yeah, absolutely. I think it's a great idea. Just almost like prophylactically, do that just to make sure that you are able to clear those toxins if you are getting those within your body from any kind of dental device.
Yeah, gluten free. Who would have thought gluten free trays? Like you gotta really think of everything these days, right? Like you would never even think to ask that. But thank you for that insight. That really helps. John, if I'm looking in the mirror, just like your average middle-aged person, what are some things I should be paying attention to, below the surface, if you will, when I'm looking in the mirror, looking in my mouth, looking at my teeth, looking at my gums? What can be telltale signs that I have great, teeth and gum health versus, hey, I really need to check this out and maybe not that you shouldn't see a dentist regularly, but I really need to make that appointment sooner than later.
There's a few things, Sachin, that you should be looking at. One, you want to make sure your gums aren't very red and inflamed and bleed easily. That's probably the easiest thing to evaluate. Any bleeding's bad for you. So it's common, but it's not normal. It shouldn't be happening. So you want to make sure you get the healthy gums under control. Any kind of crowding, crowding, oftentimes people think of orthodontics for cosmetic reasons, nice straight teeth. And oftentimes for us, that's just a side benefit of orthodontics. We want people to go through orthodontics so their bite is corrected, so that they're easier to keep clean. So you want your teeth forever, right? So you want to be able to manage healthy teeth, and a nice smile is just a side effect of that. And oftentimes, what a malocclusion or crooked teeth tells us is that there's some sort of dysfunction with your oral tissues, with your potential, your swallowing, your bite. We see that people who have really crooked teeth usually are mouth breathers.
Mm,
People who go through orthodontics when they're young and their teeth get crooked again, usually they're mouth breathers because their mouth, their tongue, and their cheeks and their lips aren't in harmony. When your tongue, lips, and cheeks are in harmony, they act like as a natural retainer. So your teeth should stay straight the way nature intended. Malocclusion, crooked teeth is a modern day problem. Hundreds
mm,
and hundreds of years ago, we don't see that in the, anthropologic studies about skulls and teeth. It's very modern. It was very interesting, Sachin. Last year, I went to Africa on a mission trip and we worked in an orphanage. And I did not know what we are going to find. I've done mission trips down to Mexico. I've done charity work in my own community in Reno, Nevada. And, typically when you're working on kids and adults in different countries or in my own town, you've got very crooked teeth, lots of decay, broken teeth, infections, and you're dealing with people who go to the dentist. So we go to Africa, and these kids have never been to the dentist. They have big, giant mouths, straight teeth, even spacing in some of their teeth, in their
mm.
permanent teeth. And you never see that in, the industrialized world. And it was mind blowing. We started doing exams on these kids, and after 7 or 8 kids, none of them had cavities. And I'm like, this is wild. But if you
Mm.
think about it, it makes sense. They've never been to the dentist. Most of them never had a toothbrush, but they were, brought up in a society where they were breastfed for a long time, which helps you develop strong muscles, just a swallow reflex. Um, and the strength of the jaw and muscles is very important in the development of the jaws. We don't develop as big a jaws as we used to, so we don't have enough room for all of our teeth. The kids weren't really introduced to refined sugars, and they really had to work for their food. So it was insightful to see that there still are places in this world where dental decay is not rampant in our communities. And oftentimes it's just growth and development that all these things happen from.
Yeah, it's so fascinating. I know you and I are both friends with James Nestor, who wrote the book Breath, and you've been to his retreat. I've been to his retreat. It's really fascinating when you go down this rabbit hole of just really understanding where good oral health starts. And you hit the nail on the head. Breastfeeding is so hugely important, and in these poor countries, they can't afford formula,
Yeah.
right? So they don't have the modern conveniences of what we have in the West, where if a female can't or may not want to breastfeed or can't because they're going to work, for example, then our children are disadvantaged in a way that we may not realize. Even if they were drinking breast milk out of a bottle, it's not the same as latching onto a breast because of the effect that it has on the facial structure and the swallowing reflexes and everything that they need for a nice, big jaw and all the spacing for their teeth to come in. And when my son went to the dentist, the first time he went to the dentist, the good news and bad news was that he had a ton of cavities, and so that was the bad news. And the good news was they were all in his baby teeth. But Deepa and I were kind of left scratching our heads, like, what the heck? Like, he doesn't eat. Like, what are we doing wrong? We felt like total failures as parents. And it wasn't until later we learned that he was a mouth breather. I didn't even think. I'm so embarrassed. Like, people call me the breath guy now. And I was completely clueless in this area. And that's actually what took me down this path to study this in more detail, because I realized, oh my God, even though Deepa had breastfed him, because he was a mouth breather, he has a bit of a tie, which we just recently got clipped. He was the cutest kid sleeping, but he would sleep with his mouth open, be drooling all over his pillow. And I have the pictures to prove it, but I didn't even think that this would affect his facial structure. And so he ended up, unfortunately, having some crowding taking place. And thankfully, I read James Nestor's book around the same time this was happening. And I realized that, all these dentists, we went to 4 different dentists, and 3 of them wanted to pull his teeth. And it just didn't make sense to me. There's no way that God designed him to have too many teeth. There's something a little bit deeper going on here. And then after reading the book, I realized, okay, his palate hasn't expanded. And it turns out, because he was a mouth breather, his tongue wasn't sitting in the right position to push everything forward and outward. And so we ended up having a palatal expander installed for him. And that really made a world of difference. And, one thing that it's important to note, you hit the nail on the head as well, is that people who are mouth breathers, their teeth start getting overcrowded because the tongue isn't acting as a spacer. But what Devin would also complain about, and I didn't really understand it until I went through this whole process myself of understanding it, is that when we have overcrowding, our hard palate is the floor of our sinuses. So if our upper jaw is small, our upper palate is small and narrow, that means our sinuses are going to be small and narrow, which makes us more prone to, sinus infections, difficulty breathing through our nose, which then makes us more prone to mouth breathing. So I went through this whole thing with my family to figure it out. And part of me is like, man, I wish I was a dentist now, because then maybe I could have seen this earlier and helped them. So what are, you talked about mouth breathing. Are there any other causes that you've identified that can lead to overcrowding?
Mouth breathing is certainly the biggest one, Sachin. And talking about the oral systemic link and bleeding gums, it has evolved into what I feel is the most significant factor, like you just mentioned, mouth breathing. When you mouth breathe, you completely change your oral environment.
Mm.
And, what we're starting to see now is oftentimes facial structures are completely different with people when they are growing up and they're mouth breathers. And sometimes it's due to allergies, sometimes it's due to tongue ties, sometimes it's due to inflamed adenoid and tonsillar tissue. And, we at my Airway office, we do scans to evaluate all those different things to try to figure out what's going on with it, because it is so important. When I first started treating sleep apnea, I was treating just adults. And, we would almost put a Band-Aid on the patient, try to protect them from having their sleep apnea or snoring. But as my kids started to grow, my kids are 13 and 11 now, I noticed challenges with them, night terrors, not sleeping well, waking up all sweaty, talking in their sleep, walking in their sleep, all these different things that can go back to poor sleep. And if you're breathing through the mouth, you're not getting the sleep you should be getting. And for our
Right.
children, it's so important to recognize that. I tell kids all the time, make sure you're breathing through the nose. have your lips sealed, and it's hard to tell a kid. Most of the time, it's the parents you have to try coach and have them go in and look at night and make sure they're doing it. I love what you say, Sachin, when you say the doctor of the future is the patient
Mm.
or the parent.
Yeah.
And for kids, the parents need to take a stand because oftentimes, I'd see a kid with huge, swollen, we call them kissing tonsils, tonsils in the back of their throat, where, unfortunately, they can hardly even swallow food, and let alone, breathe through their nose. So sometimes surgical intervention is required. We try to always prevent that if possible, but the parents really need to advocate for their kids. And a video of them sleeping is probably the best way to do that because
Mm.
I would get frustrated because oftentimes I'd say, "Hey, tonsils look really big. Go, let your pediatrician know that we see the tonsils are very swollen." And all the time we would get, "Oh, they'll grow out of it. Don't worry about it. If they're snoring a little bit, they'll grow out of it." And that's when you want to think about going to see somebody else.
Right.
Because, mouth breathers, you're breathing in the back of the mouth, and especially in my climate, it's high desert, it's very dry. All this tissue, the tonsil tissues are trying to filter the air when you should be breathing through your nose and warming it, humidifying it, sterilizing it, getting it conditioned for proper oxygen exchange in the lungs. So mouth breathers have much more swollen tonsils. And a lot of times what people don't realize is when the tonsils are removed or adenoids are removed and a kid continues to mouth breathe, a lot of times that tissue can come re-inflamed. So you
Mm.
hear about adenoids growing back, and that's kind of in that situation what happens. So you want to really work with parents and talk about, trying to really establish nasal breathing even after the surgery. Because if they go back to mouth breathing, it's probably not going to be as severe, but there will be developmental issues going on.
Yeah. And certainly for the facial structure as well, and prevent the overcrowding, you know, just for an operational definition, some people have probably heard of the adenoids and tonsils, but may not actually understand what their purpose is. So maybe you could, if you don't mind explaining that a little bit, because that might help people understand why they get inflamed when people are breathing through their mouth versus their nose.
Well, the challenge with the mouth through the nose is when you breathe, I mean, it's directly hitting the tonsils. And, it might be warming the air up just a little bit, but you've got a direct pass straight to the tonsils. When you breathe through the nose, you've got turbulence and the air spins and it gets cleared and clean from the hairs in your nose. And by the time it gets down to the tonsils and passes the adenoids, it's warmed and it should be at your body temperature. So it's a significant improvement in just the quality of air that's hitting them. One of the other things I wanted to mention, Sachin, is oftentimes, one of the things we see all the time with patients these days is kids getting diagnosed with ADD or ADHD at a very young age, being hyperactive.
Mm-hmm.
Oftentimes, this is misdiagnosed from poor sleep. You know, think about a night where you get bad sleep or multiple nights when you get bad sleep, how that affects your physical well-being. We see kids that get horrible sleep all the time. And not only is this going to agitate them and make it hard for them to do their daily activities, but long term, they're dealing with oxygen deprivation in their brain, which is preventing, good, proper development. And it's not just how much you sleep. My daughter was having headaches, and um, I didn't go to the appointment with her, but my wife Jen did. And the response from the PA at the neurologist said, "Well, make sure she's getting 8 or 9 hours of sleep." And my wife posed the question, "Well, what if she doesn't get good sleep?" And she just said, "Well, make sure she gets 8 or 9 hours of sleep." And that's what you hear all the time. Make sure you're getting 7 to 8 hours of sleep as an adult. But 7 or 8 hours of bad sleep, I don't care if it's 20 hours of bad sleep, you're not getting the sleep you need to be fully rejuvenated. So, um, you don't want to just get that certain number of hours. You want to be able to really concentrate on getting good, high quality sleep so that you can feel rejuvenated in the morning.
Have you ever struggled with sleep yourself? I know I did at one point, and I just thought that that's how you feel when you wake up in the morning, like tired, groggy, stiff, achy, because that's how I woke up every single day of my life. And I remember when I was practicing, like more physical chiropractic, and my patients would tell me that they feel, bright-eyed and bushy-tailed in the morning. They have no stiffness, no achiness. I thought they were lying to me. Truth be told, I'm like, oh, you're so full of it, right? How do I feel like so terrible when I wake up in the morning and you don't? And it turns out that I snored. It turns out I was eating gluten. It turns out that I was mouth breathing in my sleep, not necessarily realizing that I didn't really do it during the day, but at night I was. And when I started, cut out the gluten, that made a huge difference. But when I started mouth taping and doing some tongue exercises and swallowing exercises and got rid of the snoring, oh my God, I started dreaming and remembering the dreams. I started waking up refreshed, ready to go. I never had to hit snooze. I don't even need an alarm anymore. And yeah, it's been amazing. And I want that for everybody. So, and I know you do too, right? And a lot of it starts with something that we may not expect, which is the way we're breathing. And you might be thinking like we're supposed to be talking about dental health. Why are we talking about breathing? And it's because it's paramount, right? It plays such a huge role in our not just our oral health, but our systemic health as well.
Yeah, absolutely. Oftentimes we get passionate about things that are challenging for us also, and breathing was certainly one of them for me. I probably had a little bit of ADD, probably because I wasn't sleeping well. I guess, when I think back about, my growth and development when I was a child to where I was just a couple years ago, yeah, people would always say, John, he doesn't ever sleep. He sleeps on 4 or 5 hours, and oftentimes I did. And, I would feel exhausted in the morning and I wouldn't feel refreshed. And, I had that poor sleep. And like you mentioned yourself, I did snore. And it was interesting because, I was one of my first patients. I wanted to make sure to see the benefits of what we do for myself. And I wanted myself to feel better. So, using sleep trackers like the Oura Ring or the Apple Watch, those have been very beneficial for me to be able to track my sleep. And, sometimes people can over obsess about them, but they do provide good data. You just want to take it with a grain of salt. What was interesting as, I started to track my sleep and I learned I had sleep apnea myself. I started to look into ways I could expand my mouth, make my mouth bigger, make more room for my tongue to be up in my mouth instead of in my throat. Because if your teeth are together and your mouth is closed and your mouth isn't big enough, there's only one place for your tongue to go, and that's in your throat, closing down the airway. So when I went through and I was able to expand my mouth, make it bigger, do some exercises to, and learn where my tongue was supposed to be, then I started sleeping better. And my thought process was from an entrepreneurial standpoint, man, if I'm sleeping better, I need less sleep. But the interesting thing was when I started sleeping better, I could actually get an hour more sleep per night because I was sleeping better and I could stay asleep. The
Wow.
other thing people don't necessarily realize is, yeah, a lot of people who aren't sleeping well, they aren't getting into the dreaming state and definitely never remember them. So when they start dreaming well, or start sleeping better, they do remember their dreams. And then oftentimes people are always talking about getting up in the middle of the night to go to the bathroom. And when you're in proper sleep, your kidneys really shouldn't be producing urine. So when we get people to sleep better, they remember they're in their dreams, they're not waking up in the middle of the night to go to the bathroom, and they're actually sleeping longer, which is going to be so much more beneficial for brain health long term. We've been fortunate enough to sleep test thousands of patients now. And I tell patients, we look at two things. We look at brain health and we look at cardiovascular health. They're both very different for sleep. because I can have somebody who has severe sleep apnea, but they have incredible deep, stable sleep. And that's usually the guy who's freight train snorer and has apnea. And the wife's saying, you got to go in, you stop breathing all the time. And they wake up and they say, no, I feel great every morning. And at first I didn't believe it. But with what I'm seeing with all of our sleep tests is sometimes that's true. You're getting that good, deep, reparative sleep because they have a high threshold, arousal threshold, and it's not affecting their deep sleep. And then you'll have people who have no apnea and have almost no deep sleep, and they feel like a zombie all day long.
Mm-hmm.
So it's been really interesting seeing all this from the perspective of having objective data and being able to, look at a patient individualized to figure out what's going to be best for them to make them healthier. And like you said, we're talking a lot about sleep apnea, but your teeth really are, again, kind of the gateway for the size of your airway and how you breathe. So it's very important to set those up and be able to get in a proper alignment so you can breathe well.
Well, you set me up for my next question, which is Airway, right? So I flew out to see you, me and Deepa, to come visit you and visit your lovely family, but also come visit your practice to learn more about what you do. And we got to experience some of the magic that you were so kind to offer us. We did a full scan of our mouth. So you've got amazing equipment there. It's so fascinating. And you did it's a cone beam scan. Is that the right thing?
Yes,
And
I
so
can
you
come.
did a scan of my face and skull and everything to kind of get a sense of what my sinuses look like. And it was really cool to see inside, right? We could see what's going on the outside and maybe assume certain things, but I had a bit of a deviation. You were able to take measurements to help me understand, if my facial structure is wide enough or my palates are wide enough. And you also were able to identify that I have a slightly enlarged uvula. So that little hangy ball thing in the back of our throat, mine is apparently a centimeter longer than it should be. I don't know what that means, if that's a gift or a curse. And then through that process, you're able to identify some really simple, non-invasive strategies to help me breathe better at night. And I can tell you it's made a huge difference. And I want to thank you for that. So let's talk through, maybe people have never been to an airway focused dentist and are more interested in learning about more. What is that process? Where does that process start? Who should everyone see an airway dentist? Are there certain red flags that should prompt them to go see an airway dentist? Talk me through that process.
Yeah, great question. As there's become more awareness about the impact that dentistry has on airway, the American Dental Association actually came out with a statement, said that all dentists now should be screening airway in patients.
Mm.
So all dentists should have some knowledge, and they don't need to all be specialists, but they should be able to look in the mouth, look at the roof of your mouth, look at your hard palate, soft palate, look down your throat and determine maybe what risk factors you might have. Now, if they aren't doing appliances, what's important for them to know is who to refer to in their local community. Now, I don't expect everybody to be able to treat or have the answers for most of the patients, but the knowledge is out there now where dentists are aware of what's happening. So I would ask your dentist, could you evaluate my airway? Could you let me
Mm.
know how it looks? And if they are shocked by that question, then you might want to search out somebody else who, might know more about airway, if that's a concern of yours. If you're snoring, if you're breathing through your mouth, if you have restless sleep, that's a very important question to ask your dentist. And hopefully they can guide you to a place where you can get some help.
Yeah. And so as a airway focused dentist, what are some of the things that you're looking for that perhaps a non-airway focused dentist might overlook?
One big one is a scalloped tongue. I don't know if you've ever looked in the mirror and looked at your tongue, and sometimes you'll see scalloping on the side of it. And what that is actually imprints of your teeth in the side of your tongue. So what that's telling me is that you're forcing your tongue up out of your throat. You're trying to get it out of your throat so you can breathe. Another thing you can look at is what they call tori or torus, which is additional bones in your mouth. So a lot of people will have them on the floor of their mouth. There'll be little bumps on the inside. And sometimes people will have them on the roof of their mouth, one bump up on top.
Hmm.
And what that tells me is that that person is a severe clencher or grinder. So what's interesting is I found out on myself, I did a cone beam CT like you had discussed earlier to look at my airway size, and I wanted to get a little different image of it. And the second time I clenched. I'm a clencher. So when I'm sleeping at night, my lips are together, they're sealed, I'm clenching. And what I found is when I clench, it flexes all my muscles in my throat and it
Hmm.
makes my airway bigger. So people who are clenchers, people who grind their teeth, you look in the mirror, see if your teeth look like they're shorter than they used to be or are flat across. Oftentimes, severe grinders, their teeth are flat across. And what's happening is at nighttime, your blood oxygen saturation is beginning to drop down and your body goes into survival mode. It says, I'm suffocating, I need to breathe. So your jaw shifts around, oftentimes moves forward to open up the airway so you can breathe. And you're doing that subconsciously. So your body's saying, I need to breathe, I need to open up the airway, and your teeth just kind of get in the way.
Hmm.
So the body's trying to function properly and allow you to survive. And your teeth just, unfortunately, a lot of times get destroyed when that happens.
Well, you just described me because I do have a scallop tongue. And my wife says it's because you talk too much. But now, now I know it's not that. Um, so when I got my measurements done, you said my palate was, or my, the distance was adequate. Is it possible my tongue is too big, or should I consider expansion in some way, shape, or form? Are there exercises I should be doing? Where would you take something like that?
So, you know, you kind of go back to what kind of symptoms and issues you're having. So there are oftentimes people who have a scalloped tongue that have a big mouth, and normally it's a small mouth and a regular sized tongue.
Mm,
There are some people that have a bigger tongue than most people. Now, one thing that's interesting too is the tongue, depending on which area of the tongue you're looking at, it has different percentage of fat. So when you gain weight, the back of your tongue actually gains more weight than the front of your tongue.
mm,
So, you want to evaluate that also. But for you, Sachin, what we looked at is what was your sleep quality on the sleep test, and you were good. And if I did more expansion, do I think that would change that? No, for you, I didn't. But oftentimes that is a mechanism to help getting the tongue farther out of the throat to help people breathe better. So we take a very individualized approach to each patient. We never know what we're going to recommend and when and how or who we're going to send them to. When they come in and see us, it might be a deviated septum where they're not able to breathe through the nose. It might be a skinny mouth. It might be, when they were young, they had 4 teeth taken out for orthodontics.
mm.
So as soon as you have teeth taken out for orthodontics, you make the mouth smaller by bringing them all back together. And oftentimes those are patients that have severe sleep apnea. So we look at all these different things and then we try to figure out what is going to help you the most to feel better, sleep better, live a longer, healthier life with whatever benefit we can hopefully provide for them or direction, because oftentimes it might require surgery or sometimes a CPAP machine. We do not dispense CPAP machines at my office, but sometimes they're needed. They consider CPAP the gold standard for sleep apnea. Um, I think oftentimes people get the diagnosis and they just say, you need a CPAP machine. And not many people are successful at using a CPAP machine long term. And, in my opinion, a lot of times they're not needed. There are other things, that you can do as far as surgeries or oral appliances or losing weight, going through the metabolic reset program and getting healthy, learning some sleep hygiene, some different things you can do before bed to help get you in an environment where you can sleep well. So we take a whole body root cause approach to trying to figure out what works best for the individual person.
Thank you. Thank you for the thorough response. Now, um, one thing that you did for me was a special laser procedure. The name escapes me, so you'll have to remind me. Tell me what you could describe to us what that procedure is like and what it does and who could benefit from it.
Yeah, so the laser procedure we use is called fractional ablation. So basically, a lot of people know lasers are involved in a lot of cosmetics and facial rejuvenation, being able to kind of, they basically damage and traumatize the skin and it comes in and heals healthier. So the fractional ablation that we use it's the soft palate and uvula and it's the tissue that's normally vibrating when you're snoring. So what we do is we go in and we treat it, and it's creating little micro trauma where our fibroblasts and our collagen come in for healing. And what it does is it tightens the tissue up. They've used it for many years in women's health, especially after pregnancy. But it's able to tighten things up and be able to allow that airway to stay open longer
Mhm.
and oftentimes can significantly help snoring.
Yeah, it definitely helped me, and it's completely painless in case
Mhm.
anyone is wondering. And it took just a couple of minutes, so it was a really, non-invasive, painless procedure that has lasting benefits. And you say that sometimes people just might need it once, or maybe even just a couple of times, and it seems to do the trick.
Yeah, typically we do 1 to 3 treatments. And sometimes people I mean, within minutes afterwards, they're like, boy, I can breathe so much better. Sometimes they need a few treatments before they're starting to see the big benefits of it. But snoring is such a major impact on our society also. There's research out there that shows 31 to 35% of people are sleep divorced.
Hmm.
Couples sleep apart in separate bedrooms because of snoring. And it's interesting because some of the biggest impact we have on our patients are the husband and wife who don't sleep together anymore. And once we're able to use the laser and get them in an appliance to help protect and manage their airway, they're back in the same bedroom and we bring them back together. So that's one of the things that, really puts a smile on our face when we hear that about getting the couples back in the same room.
Yeah, I can't even imagine not sleeping with my wife. I would make
Mhm.
sure I do whatever it takes to ensure that that's happening on a nightly basis. I mean, there's so many benefits to sleeping with a partner. Oxytocin, obviously builds a bond in your relationship. So yeah,
Mhm.
if that's you, if you're one of the 1 in 3 couples that are sleep divorced, then I have a great dentist and airway specialist that I can send you to that will help you take care of that. Um,
Yeah, the snoring just doesn't affect the snorer, it affects the partner also significantly. Oftentimes,
yeah,
probably more as far as a mental standpoint.
yeah, and that makes total sense. And then let's talk about some of the systemic effects of let's say dysfunction in the mouth. I want to spend a few minutes, perhaps, if you'd be open to talking about root canals.
Mhm.
Because that could be a source of infection, but also inflammation and a stealth cause for people's chronic illnesses. I'd love to talk about the oral microbiome a little bit more and what helps it and perhaps what disrupts it. And then also wanted to, talk about perioprotect, which is, something that we had done while we were there. We got scanned for perioprotect. So let's start with root canals. I love your take on root canals. When are they appropriate? When are they not appropriate? What are some questions that people can ask if that's on the table for them to have a root canal done?
Yeah, Sachin. So root canals are done for quite a few different reasons. Sometimes it's infections. Sometimes it's a fractured tooth. Sometimes it's to have some more tooth structure to work with to be able to rebuild a tooth. And where I think root canals can be dangerous is when you have a long-standing chronic infection that hasn't been treated. You have a lot of bad bacteria at the ends of the roots of the teeth. And, you know, I think root canals have been beneficial for many people, but oftentimes when root canals are done, it's challenging to completely sterilize that tooth. So when a root canal is done, they take away the blood supply of the tooth and the nerve. And if bacteria has entered into that root canal system, being able to sterilize it is key. Oftentimes, a nerve of a tooth is ribbon shaped. It's not just a circle.
Mm,
Most of our instrumentation is just a straight circle. So when we see root canals years later that still have an apical lesion at the end of their roots, there's still chronic inflammation in there. There's bad bacteria in there that never fully healed. And then that's where I would be concerned about root canals being bad, is that it never fully got rid of the infection in the body. It might have got rid of the infection in the tooth, but there's still an infection in the bone.
mm. What are some alternatives? So if somebody does get recommended a root canal, is it better to just pull the tooth out and then wait for it to the bone to heal a little bit and then put an implant in there? And if so, what are the best tolerated ways about going ways to go about that?
Mhm. Yeah, it depends on how much tooth structure is remaining and kind of, I would also look at the person. We have so much information about people now and genetically, how they react to inflammation. And for people who have kind of a hyper response to inflammation, which is not good for dementia and Alzheimer's, you might really consider taking the tooth out and letting the infection clear and then doing an implant later on rather than doing a root canal on a tooth that has a major infection in it and hoping that it heals itself. So you want to take that into consideration, kind of looking at the root cause and the way the body responds to that. Now, most of the time when you take the tooth out, it will clear. Your body will get rid of that infection and the bad bacteria. Unfortunately, once it is infected, people sometimes think that it'll go away by itself, or what'll happen oftentimes is you'll get a infected tooth and it'll swell up and there's significant pain. And then that infection finds a way to drain. So you have pus coming out of your gums. And once it drains, the pressure goes away. And they think, oh, it's fixed. It doesn't hurt anymore. Or they go on antibiotics and it gets better for a while. And they're like, oh, we're all better. I don't need to worry about it anymore. But it always returns. So either doing the root canal to get rid of the infection or taking the tooth out are really the only two options you have once you do get an infected tooth.
Hmm. Yeah, lots to unpack there. And I guess, make sure you're seeing a dentist that supports your overall health, right? Not just myopically focused on the
Mhm.
tooth, but just looking at the big picture and the long-term picture, I think is really important for people. Let's talk about the microbiome, because one thing that people may not realize is we talk about the microbiome and we hear about it, and it's a buzzword that's been going around for over a decade now, and most people think of it in their gut. But the mouth is where our digestive system actually starts physically, right? So let's talk about that a little bit. And what are some of the things that can negatively impact the oral microbiome? And what are some of the things that we can do to restore a healthy oral microbiome?
Well, I believe the worst thing you can do is breathe through your mouth.
Mm,
When your mouth dries out, you get the pathogenic bacteria building up, which are much more harmful for decay and gum disease. So that's number one. Start breathing through your nose, especially at nighttime. Um, You can get bacterial tests done from a simple saliva test that shows what type of bacteria in your mouth. Some people, like I mentioned, have very, very virulent bacteria, bad bacteria that cause, the gum disease. And they have found bacteria from the mouth in the plaque buildup in the heart or in the arteries. And one of the most challenging bacteria out there, called Porphyromonas gingivalis, PG, they've actually found that it can cross the blood-brain barrier, and they have found it in the brain of Alzheimer's patients. So there was a study that they were just trying to block just that one bacteria from entering, getting in the bloodstream and getting to the brain, and hoping that would be a treatment or a cure for it. And I believe it helps. I think they made it to clinical, a stage 3 trial, but there's so many other inflammatory factors involved with the process of Alzheimer's disease that it's a portion. I believe it helps, but it's not the only impact on it. So you can get a test to see what type of bacteria you have. There are some probiotics that help out with it. And talking about the microbiome of the gut, they have also found the bacteria from the mouth in the gut and in the intestines. And what they have, think about your process. You swallow saliva. In your saliva, there are trillions of bacteria.
Mm-hmm.
And if you don't have proper stomach or gut health, that bacteria is not dying in the stomach with the stomach acids, and it's moving all throughout the rest of your body. And it can be extremely detrimental when it gets down into the gut and intestines.
Man, it's amazing that, our bodies can do all this, and keep us alive and functioning, despite the fact that some of us might be mouth breathing, despite the fact that we might have imbalances in our oral microbiome. I mean, we're so resilient, and it really is a gift and a curse, but it also shows us what our potential is, right? If we could identify some of these rocks in our backpack, so to speak, that are holding us back metabolically, from an inflammatory standpoint, from a cognition standpoint, and from a performance standpoint. I mean, imagine what our individual potential is once we kind of clear some of these things. And that's really what I'm after. And, I'm not, and I know you're after that too, right? You're after, like, how do I show up as the best version of me right now, right? Not wait until I get, sick or ill or unwell and then try to figure it out. I mean, that's, the worst time to try to get healthy is when you're not feeling good, because everything feels hard, right? Just feeling normal feels hard at that point. I mean, the idea of feeling exceptional might elude us. So I love that you and I are on the same page, being very proactive with our health. And that leads me down to my next question and topic, which is PerioProtect. So describe to us what PerioProtect is, why you use it in your practice, who should use it, and what are some of the benefits?
Well, I believe PerioProtect is beneficial for anybody because, unfortunately, most of us have some sort of pathogenic bacteria in our mouth. And most of the pathogenic bacteria, the bad bacteria that can cause disease, they like environments that do not have oxygen in them. So PerioProtect's a very simple concept. We do a digital scan of your teeth. They make a model. They actually go in and they trace along the gum line in the model, and then they make a tray that's custom fit to your teeth, custom fit to your gums, that is a carrier for a low percentage hydrogen peroxide gel, where it actually acts as a pump to pump down in your gums. So in your gums are the areas where there's a lack of oxygen, where these bad bacteria can thrive. When hydrogen peroxide breaks down, it breaks down into water and oxygen. When these bacteria are exposed to oxygen, it kills them. So studies show out of USC that right after a 10-minute mark, you get a profound, significant impact of bacteria dying off from the hydrogen peroxide gel. So they've tried many different ways to try eradicate this bacteria. I mean, think about what happens when you go to the dentist. They scrape your teeth and they polish your teeth. Now that kind of works. It helps keep smooth teeth. It cleans the teeth, so there's not a lot to collect on it. But it's absolutely impossible for them to remove all the bacteria in your mouth. So Perio Protect is something that you can do on your own at home, and it will have a profound effect on your oral microbiome, getting it to a healthier state, and being able to prevent that bad bacteria from thriving. Because the bacteria collect in your teeth and they actually create communities and nutrient channels, and there's all these different bacteria that begin working together, and very few things can penetrate that. Antibiotics can't penetrate it. Brushing alone can't penetrate it. Flossing can't penetrate it. But the hydrogen peroxide has shown that it can actually penetrate that biofilm to kill off the bad bacteria.
Yeah, when I started using it, one of the things I noticed is a whiter teeth. So that happened within probably about a week or two. And I also noticed that I would wake up in the morning and it would feel like I had already brushed my teeth. So it completely got rid of that, whatever that is for each individual. For me, it wasn't too bad because I've been mouth taping for many years. Certainly, if I think back to when I was growing up and mouth breathing and snoring, a totally different scenario at that point. But even then, it felt even my mouth felt so clean in the morning, and I would almost wake up and be like, did I already brush my teeth? Like, it was that refreshing. So I know it's making a huge difference for me, and I'm so grateful that my wife Deepa and I, we both got scanned and we both wear our trays and hold each other accountable to it. Uh, I'm curious, and I'm sure all of our listeners are curious about this too. What does, a dentist like yourself whose approach I really value and perspective I really value, what's your oral care routine look like? Maybe you can walk us through that. Like, when do you brush your teeth? How many times? What toothpaste do you use? What gadgets, if you have any, do you use? You're a gadget guy like me, so I'm curious if there's any gadgets that you really like. Do you oil pull? Do you tongue scrape? Like, give us the whole 9 yards.
Yeah, great question. It's changed over time. And again, you look at risk factors. I haven't personally had a cavity for a long time. So, you know, I'm doing some things right. And again, it starts with having the mouth closed and breathing through the nose. Typically, I brush my teeth in the morning. I'm usually intermittent fasting, so it's not right after breakfast because I don't have breakfast. But I do brush it just for that kind of more freshness feeling. I use a gel, which is not abrasive, one that has a hydroxyapatite in it, which is one of the building blocks of the teeth. I'm not using a fluoride toothpaste. Now, sometimes fluoride toothpaste can be important for people. I'm not completely anti-fluoride, but I don't think everybody should have fluoride. And throughout the day, after I eat, I'm always trying to rinse my mouth with some water afterwards. One thing I learned from you, Sachin, is it's very important to use your teeth what they were made for chewing your food. That's where
Mhm.
digestion begins. And so chewing each bite of food for 30 or 40 times, and that's hard to do when you're trying to run around and multitask. So really sitting down, being in that parasympathetic, relaxed state when you're eating, and having very few liquids when I'm eating meals so that I do keep the strong stomach acid. I don't want to dilute the stomach acid for digestion. Um, and then in the evenings, I will brush my teeth before bed. I will floss. For some people, water pick is a really beneficial thing if you have big gaps between your teeth and you get things caught in it. So we recommend water pick often. I do use a powered toothbrush because it just does a lot of the work for you. And then you don't have to put so much force in scraping because again, with my kind of type A personality, when I brush with a manual brush, I'll get in there, I'll brush hard and fast. And then, again, you just have to kind of sit and relax and think, just light brushing, just make sure you get to the spot. But typically that's what I do when I use a manual toothbrush. Um,
Would you okay sharing the brand of toothpaste or toothbrush and toothpaste you use?
so I use a Sonicare toothbrush. That's been my favorite. Oral-B is good also. Toothpaste, I kind of jump around because I'm always trying new things.
Hmm.
I really like carry-free products. It's a much more natural product, and they have a lot of good rinses with a very high pH, and they don't contain fluoride, and they have xylitol in them. So I really like that product. It's one of my favorites out there. I do tongue scrape. Um, and it allows, again, kind of that freshness of breath. Your tongue harbors a ton of different types of bacteria. I do not use mouthwashes with alcohol in them. A lot of times the mouthwashes out there, they are very acidic for shelf life,
Mm.
and I think do more harm than good. They can kill off the bacteria that produce nitric oxide for your body. And nitric oxide is so important for blood flow and getting your cells to where they need to be in your body. And right before bed typically is when I do my perio protect. And that way I go to bed with a nice fresh mouth. And I do wear it's called a mandibular advancement appliance, which shifts my lower jaw forward. It holds my jaw forward, which pulls my tongue forward and prevents it from falling back. So when you're on your back, most of the time that's when people snore. But with the appliance, it holds my jaw forward, holds my tongue forward, keeps my airway open so I can breathe effectively.
Love it. Thank you for that thorough
Yeah.
explanation. Unless I missed it, do you do any oil pulling? Is
You
that
know,
something you?
I have tried it. Um, I can see the benefits of it, but I have not. It's not in my normal routine. I do have some on my counter at home that I will do from time to time, but it's not like brushing or flossing or perio protect. It's not
Okay.
in my yeah repertoire right now.
Okay. So just like you, I'm type A in some regards. So more is more, right? Instead of less
Yeah.
is more. So at one point I had an electrical toothbrush and I was like brushing really hard. And that obviously is not good for the gums because it causes receding from what I understand. If somebody has a receding gum line, are there any natural ways to heal those, like regrow the gums, or do we just have to wait until it gets really bad and do grafting procedures?
Yeah, usually when the gums have receded, so when the gums are receded, you've lost bone. And that's the underlying foundation of where your gums are. If you don't have bone, your gums will shrink up. If you have bone, your gums will stay. So
Hmm.
unfortunately, once the gums have been lost or receded, they there's no way to have them grow back by themselves. So gum grafting at that point is really your only option to get the gum higher back up on the teeth. So it'd be awesome if someday we can find a way to regrow bone around teeth.
Maybe
But it's
stem
not there yet.
cells.
Yeah, right. Yeah,
it's
they're hard to regrow teeth, which could have a major impact on how we replace teeth. But unfortunately, they've been able to regrow teeth, but we're all individualized, and all of our teeth are shaped a little bit differently, and they don't know how to tell a molar to turn into a molar. It might be an incisor that turns into a molar, or a molar turn into an incisor. So I think we'll get there, but we're not yet.
Yeah, it'd be interesting. A mouthful of molars or incisors, right? Either way.
There'll probably be
Um,
some people that want that for some reason.
I'm sure there are, right? It'll be the next thing. People start shaping their teeth in
Yeah.
that way. Veneers, I'm sure there'll be like veneers where people can get all molar teeth installed. Speaking of veneers, tell me more about veneers and who they're for, what your thoughts are on them, and what are the pros and cons?
Veneers are great. We use them all the time. Most people think about veneers as the movie stars or the newscaster who have these big white teeth. Veneers oftentimes they can help, and this kind of goes more towards the emotional side of things, how people feel about themselves. Veneers are a porcelain restoration, which will cover a portion of your tooth, which can change the shape, size, color, contour of your teeth to, you can make crooked teeth look straight.
Hmm.
Now, they're not something that I will do on a patient if they're like very high caries risk and they don't take care of their teeth, because you can get cavities around veneers. It's not going to fix your teeth that you're never going to get a cavity again.
Mm.
And, if you don't take good care of them, they potentially could collect more bacteria than your natural tooth. So you got to be very careful about that. But do I do a lot of them? Yes. Are they very beneficial within my business? Yes. Can they fix crooked, worn, discolored teeth? Absolutely. So I do get, I do enjoy doing them, and it's very rewarding for me to give somebody a new smile, just,
Hmm.
knowing how it's going to make them feel about themselves, which probably makes them more involved in their own oral care and, overall health.
Yeah, I mean, a bright, beautiful smile can change your life, right? And really change how you show up in the world. Um, not I'm not making this about me, but I want people to know that, I'm a human just like everyone else, and we all have things that we struggle with or questions that we have about our oral health. And one of my questions for you was about Invisalign and whether that's appropriate. And sometimes you think, okay, well, I'm 47, and do I really want to move my teeth around? What are the pros? What are the cons? And I'm really sitting on the fence about it right now. So either talk me off the edge or talk me over the edge. What are your thoughts on Invisalign for let's say someone with my scenario or situation?
I think it's a great option. I really do. It allows you to be able to, clean the teeth and move them in a manner that oftentimes is faster than like regular braces. So you can take them off, you can clean them. Traditional braces work too. And, I have that conversation with people when they come in and see me and they want straight teeth. We go over the different options, and there will people who say, I probably won't be very good about wearing Invisalign, or I go out and socialize a lot and I drink wine, or, some other excuse why they can't wear them. I'm a singer. I speak all the time. I'm not going to be able to wear them. And if you don't wear them, they're not going to move like they should. And then
Mm,
nobody's happy. Patient's not happy. The doctor who's doing it's not happy. So sometimes regular braces are the best way to go, but it's much harder to keep your teeth clean around regular basis because they're collecting food all the time.
mm,
And if you have a big piece of food caught in your braces, bacteria is able to digest those carbohydrates and make acid, and that acid goes everywhere. And that's how you get cavities typically. So, not saying that braces typically cause it, but having the food in between your teeth is one of
right,
the
right.
factors. So, I think Invisalign or any kind of clear aligner system, I've done it myself, and it was great for me. So, we're a big proponent of it. It helps get your teeth in a better position, helps decrease crowding. You can improve your bite, which is going to long term help out your oral health.
Okay. Well, now I know what my next move is. So thank you. I appreciate that. So that leads me to my next question. So if I do see an Invisalign, practitioner, if I go to one versus the other, does it make any difference? Or like if I go see an airway specialized practitioner, will they form a different end result for me versus somebody who isn't airway informed? How much say does a practitioner have in the end result?
So the great news about Invisalign or any of the clear aligner therapies, the doctor in charge gets a animation of how the teeth are going to move.
Mm,
Now, they oftentimes have an orthodontist on staff, which helps determine this. And then it's up to the clinician's individual experience, kind of what they see and what they want to accomplish. So if having, an airway doctor look at it and say, hey, you're narrow, we want to expand that out above all else, and then we'll fit the rest of the teeth in place, that would be important. Or there are some providers who prefer to account for crowding by making some of the teeth thinner. So although it works, you're making the mouth smaller.
mm,
So whenever I prescribe a case for orthodontics through clear aligners, I have it set up with an airway focused plan. So if you go into your dentist, I would say I want to look at an airway focused orthodontic plan. And then when you prescribe that, typically the orthodontist setting up the case kind of knows.
Okay.
So in the very beginning, if they're aware of what you're looking for, that's the important part.
Love it. Thank you.
Yeah.
Thank you, John. This has been very enlightening. I could talk to you for hours because we have so many common interests. And this, I hope, inspires people to take better care of their oral health because what happens in the mouth doesn't just stay in the mouth, it goes everywhere. It affects our brain health, it affects our heart health, it affects our inflammatory processes in the body. And, you and I are trying to live the best, longest life that we can. And it's important that we have all of our teeth. I think there's a significant deterioration in somebody's health when they can't chew their food
Yep.
or when their oral microbiome shifts or changes. I remember my grandmother, she ended up having to have like a lot of her teeth removed and she had dentures installed and she could never get her dentures to feel comfortable. So she hated eating. And it was just like really depressing to see somebody who enjoys food, good, healthy, quality food, not be able to enjoy it because their mouth wasn't comfortable with every bite that they would take. So that inspires me to take better care of my teeth because I love to eat and I want to make sure that I'm taking care of my mouth, I'm taking care of my brain, my heart. And this is one of those areas of our body that I mean, everyone, I'm sure everyone watching this brushes hopefully at least twice a day. But if we could do it with a little bit of more awareness, maybe more gratitude, take that practice, turn it up a notch, use the right toothpaste, do some tongue scraping, use the right type of toothbrush, right? Don't be so hard on your teeth, right? Be gentle. Less is more, as we talked about. Then we and of course the other things that we mentioned, like the hydroxyapatite, the xylitol. Just go back and watch what we talked about because it gives a lot of insights into how to make sure your teeth last you as long as humanly possible. And until we can just grow teeth back, we've got to take care of them. So again, thank you for the work that you do. Thank you for taking such beautiful care of Deepa and myself and setting us up for success. And again, for your honest insights. Where can people learn more about the work that you're doing? Reno is just a straight flight out for us through Denver. So it's two flights, but we got there pretty quickly and it was well worth the flight out there. So I know you'd work with people who fly in and come and see you. Tell us how they can get in contact with you and I'd love to send people your way.
Yeah, yeah, we love speaking with people, even if it's a remote, Zoom meeting to kind of discuss what they may be experiencing. I just want to circle back for a second, talking about your grandmother and
Mm,
the teeth. And oftentimes people think, oh, I'll just take my teeth out and get dentures. And, I had a professor tell me once that dentures are not a replacement for teeth. Dentures are a replacement for no teeth because
mm,
you lose about 80% of your chewing efficiency. And then oftentimes with a denture, you can't taste your food, so it's not as enjoyable.
mm,
We get patients all the time who are, say, 75 years old and their tooth is having some trouble and they're like, well, just take it out. I don't need it. I don't have many years left. And I always tell them, now is the most important time for you to have proper nutrition.
mm.
So you could be around for another 20, 25 years, and it's going to be so important for you to be able to chew your food effectively to stay healthy.
Yeah, man, I wish you were her dentist to tell her that, because sometimes people just get frustrated or they get the wrong advice and it can really affect their quality of life, especially in later years. And there's not much you can do, right? Because chewing our food is like sets us up for digestive success. So even if
Yeah.
you liquefy, even if we were to liquefy all of her meals, the fact that she's not chewing her food means she's not going to thoroughly digest it. So thank you for adding that. Again, before we forget, how can
Yeah.
people get in contact with you?
So, they can reach out. If you go to our website, there's a lot of good information on both the dental side and the airway side, sierrasmiles.com or sierrasleepwell.com. And if you reach out to us, Either one is info@sierrasmiles.com or info@sierrasleepwell.com and get in contact with our office. Like I said, we'd be happy to set up a consultation or a Zoom call with you to kind of go over different opportunities or thoughts of or ideas of, what in what ways we could help you get the desired result you're looking for.
Amazing. Thank you, John. Thank you for sharing your time with us today. Thank you for, again, taking care of me and my family. I appreciate you. And if you're watching this, John is the man. You got to go see him. He's got a great team. Nikki's part of his team. His lovely wife, Jen, is part of the team. And they do phenomenal work out in Reno, Nevada and Lake Tahoe. So you can add a beautiful, few days. Check out Lake Tahoe. It's a beautiful location and have a beautiful, amazing experience and walk away knowing how to take the best care of your teeth possible and make sure they last a lifetime. So thank you again, John. Much love, much appreciation. Until I get to see you and hug you again, wishing you an amazing day.
Thank you, Satch. I really appreciate the opportunity to talk with you as always, and look forward to just continue to getting the word out and educating people and helping them become aware of the opportunities out there if they search them out.
Thank you.
Thank you.